In this short video, I'm going to talk to you about non-surgical rhinoplasty, also known as non-surgical nose job. I'll be answering some of the most commonly asked questions about the non-surgical nose job procedure. Can I reshape my nose without surgery? The answer is yes. We are able to use dermal fillers to reshape the nose to a very large extent without you having to undergo surgery. There are, of course, limitations. There are certain things that can not be achieved with a non-surgical approach, but in terms of straightening the nose bridge and as well as reshaping the nose tip, dermal fillers actually does a very good job. And many people wonder, how does a non-surgical rhinoplasty actually work? The non-surgical rhinoplasty is essentially by injecting dermal fillers into the nose to reshape the nose. Things we can achieve with this non-surgical or non-invasive approach are we can straighten the nose with dermal fillers. We can also alter the shape of the tip to make it appear sharper. We can also inject into the nasal base to give the nose a lift. So from the side profile, you'll look more sort of lifted. And finally, to a very small degree, we can actually narrow the size of the nose to make the nose appear a bit smaller from the front view. So how long will the results last? This will depend on the type of filler injected. So my favorite type of filler for the nose is from the Juvederm Vicrous range and specifically the Juvederm Volux. Juvederm Volux for the nose area should last actually up to 18 months, which is really impressive. Obviously, in between now and 18 months, you may require a second top-up just to maintain the shape. But most of the time, the fillers will actually be in place for 18 months. And then over the course of 18 months, it will only gradually dissolve without causing drastic changes to your appearance. Will nose fillers make my nose look bigger? It depends on how much it's been injected. I personally rarely use more than 1 ml at a time. With the small amount being injected each time, the migration of the filler will be to a less extent. Therefore, the nose doesn't typically end up looking bigger. However, if a practitioner injects an excess amount within a short space of time, occasionally that will force the filler to migrate to other areas and make the nose appear wider. But to summarize, if you choose the correct amount of filler and inject with the correct technique, the nose should not look bigger. Are nose fillers dangerous? The nose is a very technical area of the face to inject. It is full of blood vessels and especially arteries. Therefore, it makes the nose a quite tricky area and dangerous area to inject. If by accident the dermal filler is being injected into an artery, this can lead to very serious consequences, such as the nose going into necrosis and tissue dying, and as well this can be linked in rare circumstances to blindness. Therefore, it is really important that you come to a very experienced practitioner who knows the anatomy of the nose very well to avoid such complications. If you have any further questions about the non-surgical nose job, you're more than welcome to drop your questions down below and we'll get back to you as soon as possible. If you are interested in having a personal consultation with me, I am in at Pulse Light Clinic every Wednesdays and Thursdays. For the rest of the week, I can be reached by phone or WhatsApp.